the corona acceleration, as I call it, the jump, for example, from 1 case to 100,000 cases in India, Dr. Nabarro, took what? 110 days. But it's taken just 5 days to move from 500,000 cases now to 600,000. Is that a worry? Should India be worried at the sheer pace of growth now of the virus?
Yeah, it certainly is accelerating. But I want to stress that if this virus is moving without any restraint, it's capable of having a doubling time of around 2.5 days, i.e. you move from 100,000 to 200,000 really quickly. And actually, at the moment, the rate of spread, although it's still getting quicker, it's nothing like as quick as it would be without proper action being taken. So yes, it is a concern that the rate of spread is speeding up, and I know that authorities are looking at this, but I want to stress that it's nothing like as fast as it would be if there was no action being taken.
But then should we as a country be looking at this acceleration number at the COVID positive cases as the top line, or should we be focusing, Dr. Nabarro, on the fatality rate, which in India is around 3%? Is fatality rate and recovery rate the real key numbers now to look at continuously?
There are so many factors that need to be looked at by a government when deciding strategy. You see, the number of positive cases is an important figure, but it is hugely influenced by the availability of testing and also by the extent to which people are prepared to be swabbed for tests. The death rates are important, and in fact, they're often the most profound indicator of all. But again, there are settings where not every person who dies of COVID is recorded, and perhaps even some of those who die not of COVID are mistakenly classed as COVID. By and large, in India, your death statistics are pretty good. But there are other indicators that I think are important. One is the percentage of tests that is positive. Usually, if you run a major control program, you're expecting about 3 or 4% positive. If the percent positive rate in a particular area starts to go up, then that's a suggestion that transmission is increasing. And then lastly, we are all the time interested in the capacity of local authorities to be able to respond quickly in case a new outbreak develops. That might actually be the most important indicator of all, and it's based more on a judgment as to whether or not in each of your districts you do have the capacity to respond quickly and close an outbreak down. And because I've been getting a lot of information from colleagues throughout the country just sharing with me their actually pride at what they've been able to do, I do find myself impressed that that capacity to suppress outbreaks seems to be pretty widespread in India, and that's why many districts are still, as you say, I think, green and in good state.
But Dr. Nabarro, the positive rate, the corona positive rate in India is now around 7 to 8%. Now that's getting to that danger area. It's well above what we are seeing in Russia, which is say 2 to 3%. Is that a big worry? Is that again something we have to simply come to terms with, that as the spread continues, the number of cases will rise, especially those with mild symptoms, and then look at improving the health systems? The key is to ensure that there are enough hospital beds and the health systems are in place.
I think that your conclusion is the one that I would support. You know, the real thing is to focus on the performance of the public health system. And we have to remember that this is requiring a constant capacity to be able to detect cases and then to isolate them and to trace contacts. It's tough work, and it's particularly tough in densely populated urban areas. And it's monsoon and it's hot, so altogether it's difficult. And I think the really extraordinary thing is the overall capacity of public health services in India is strong, It's varied, of course, from some districts. You've got better performance than in other districts. But in general, I would give that the main emphasis. I think this 8% positivity rate on testing, and I heard that it had gone up, is a slight concern because it makes one think that perhaps in some areas there is an increase in numbers of cases. What I would want to do is to try to check these percent positivity rate figures disaggregated, at least by state and ideally by district, and then it becomes a bit easier to make sense of them. In summary, as we move forward, the really most valuable data are the data that are disaggregated by quite small administrative units. That makes it much easier to understand where the virus is.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.